really
Oh,
appreciate
absolutely. Absolutely.
it. Yeah. I like your background. I got to improve my background.
Yeah, we have this big backdrop, so it comes in handy.
I got to do that with saying Senator Eldridge. Excellent. Well, good evening, everyone, or should I say good afternoon. I'm State Senator Jamie Eldridge, and really want to thank those that are following here on the first of the 2021 Uplifting Voices video cast that I'm doing. And this is for those that are watching for the first time. Last year, really in response to racial justice protests, reached out to interview Black community leaders from across Massachusetts to get their perspectives on a wide range of issues. And really honored to have someone who's been a good friend of mine for many years. We worked together at the State House, and for the past couple of years, Dr. Moses Dixon, the CEO and Executive Director of the Central Mass Agency on Aging. Did I get that correct, Moses?
That is correct.
Excellent. And as we were saying just before we went live, you have a much nicer background than me, so I like it. But thanks so much for coming on. And I think what I particularly love, not only about the work you're doing, but how we came to have this conversation today, is just we were catching up last week, and suddenly there's an increased focus on the Baker-Polito administration's vaccine rollout, and just trying to get as much information as possible. I will say, as a legislator, I think that it's fair to say that a lot of us really didn't have the whole picture of the rollout, how it was going to be delivered to seniors, obviously all the other categories of individuals, from teachers to healthcare workers to essential employees. And then of course, the other piece is the racial equity lens that became very clear from early on, that there were not enough vaccination sites in serving communities of color. And so why was that? And then how do we reach everyone? So a lot of weighty topics, but I think the first thing, just because you are really the first person to introduce me to the Central Mass Agency on Aging, which does serve a number of my communities, but I really, quite honestly, wasn't that familiar with it. So if you might, again, thanks for coming on, and if you could talk a little bit about what the agency does and its mission, that would be great.
Yeah, absolutely. Well, Senator, Happy New Year.
Yes.
Thank you for asking me to come on to talk a little bit about the Central Mass Agency on Aging, but also talk about some of the challenges and opportunities around the vaccine rollout across the state. So the Central Massachusetts Agency on Aging has been around for 46 years. It was created out of legislation that Congress passed 46 years ago under the Older Americans Act, which pretty much said that in each county or every community, there's supposed to be this designated area agency on aging that work with community partners. For example, in Central Mass, we have 3 community partners that we partner with that are called ASAPs, which are Aging Services Access Points, which in the Worcester area is Elder Services of Worcester. In Fitchburg-Leominster area is the Massachusetts Home Care Corporation. And in the Southbridge Dudley area, we work very closely with Tri-Valley Elder Services. But we cover all 61 cities and towns in Central Mass, as well as working very closely with the 60 senior centers and councils on aging in our area. And we're just here to provide funding for Meals on Wheels to our partners, legal services for seniors. We currently run the Central Mass Ombudsman program, which sends in staff and volunteers into nursing homes to make sure that our seniors are being taken care of and that they have an advocate on their behalf. So that's a little bit about the agency. Um, Now we can go in to talk about the vaccine rollout or any other topics that you wanted to talk about.
Yeah, absolutely. And I think the first thing is given, not only the mission of your agency, but also you cover a lot of communities. I remember when I, met you at your office, just showing me the map. It's quite a large area. And quite honestly, there's a lot of I would say, rural and urban, poverty in that region, sort of Worcester County is what has been the just general observations you've had since the pandemic began about state support for our seniors? How have you seen it come out?
Look, I think, COVID-19 has really been challenging for all of us. It has disrupted our lives in a number of ways. And I would say, for the most part, the state's executive office of elder affairs, as well as with the Baker Polito administration, has been very hands-on in terms of making sure that our seniors and our older adults and caregivers are getting the support that they need in terms of, having access to nutritious food or having that support that they need in terms of caregiver support. So for the most part, it has been an all hands-on approach from where I sit in the aging network. And we meet monthly with the leadership of the Executive Office of Elder Affairs, as well as with another number of CEOs and executive directors across the state. And people have really been hunkering down to help one another. So it's been really good to see that.
That is great, and of course, there's already been a particular focus on those who are seniors to especially stay home and limit contact outside, and even the grocery stores having those early shopping hours. But now with month or so back, when it became clear that vaccines would start to be arriving in Massachusetts, and the governor set up these phases, and obviously we're just beginning the vaccinating those who are 75 years or older as far as the general population. And so how do you see that has been going, and how do you see the effort to vaccinate that first critical group of individuals?
Yeah, absolutely. Look, this vaccine thing, because of the challenges that we're facing, and we've never faced anything on this scale before. So coming up with the plan and executing it, there's been some challenges with that. And I think, this week there's been a little more clarity on where the state is in terms of this phase that we're at now, where 75 and older are able to get vaccinated, with sites across the state, as well as partnering with pharmacies across the state, which Massachusetts is the first in the country to be able to start a pilot program like that. But as I said to you last week and earlier, the challenge, Senator, is really about how do you get folks to go get the vaccine? That is the challenge, and particularly with older adults and communities of color here in Massachusetts, is how do we convey a message, number one, that it is safe to take, and two, how do we get folks to these places that need to take the vaccine?
Absolutely. And I think that was one of the things just from our conversation last week about, how do you get people to be comfortable to take the vaccine? I know you mentioned, I think, the sort of family model to get, the whole family, or particularly seniors, to be comfortable. If you can you talk a little bit about that? Because I think this is the thing that, we're, quite honestly, not to generalize too much, but I think that, often with a sort of, middle class lens, there's this sense that, there's no need for additional outreach to make people feel comfortable to take the vaccine. Anyone who doesn't take the vaccine, what are they thinking? But they're actually, our community health outreach strategies and tactics to actually make sure that everyone, is comfortable to be vaccinated, because otherwise, quite honestly, the vaccine's not going to work.
Absolutely. Look, I believe it's states like Georgia and West Virginia that have taken this approach that instead of this phased approach, they've been more inclusive in terms of getting the whole entire family
Mhm.
to go take the vaccine. And from what I've been reading and seeing, that seems like that is approach that has been working. And I think at some point, once we go through these phases, we should really, as a Commonwealth and as a network, really think about how do we still get those families or folks that are still on the fence about taking the vaccine. How do we make this a family affair to be able to say that, look, it is safe to take, one, and number two, the quicker we do this, we can get back to some sense of normalcy so we can see our friends and families again and to be able to do the things that we want to do. So the phase approach that the Commonwealth has laid out, it is working to some degree, but at some point we've got to think about how to make this a family approach at some point.
Absolutely. And, I'm the first to note and highlight that, we have a fairly underwhelming public health system in Massachusetts. I would say in America in general. I know that, I'm the Senate sponsor of the Medicare for All legislation, which actually the bill we're filing, it would have a $500 million increase in spending in public health infrastructure, whether state DPH or local boards of health. Is that part of that, which again I'm just starting to learn, but the need for public health entities, for any healthcare agency, is to employ unique strategies to reach out to various populations that might have concerns or resistance to taking the vaccine. So are you seeing that improve within the state? Is that something that you're seeing, those strategies or outreach efforts?
Certainly there is a number of strategies, across. I can certainly speak from where I sit in terms of the aging community, and there is certainly within the network there are strategies that folks are talking about and that are planning on applying. And so, but having said that, there's always room for improvement, always room to add more strategies in the conversation. At this point, the more strategies and minds that we can get around the table to make sure that we're reaching as many folks as possible, particularly our older adults and people of color who have disproportionately been affected by COVID-19. I mean, right before I got on with you, I always like to look to see what are the numbers in terms of the unfortunate deaths with COVID. And right now we're on pace to pass 450,000 Americans would have died to COVID-19. So we are still in the midst of this crisis, this pandemic, and it's equally important that we continue to wear masks and we socially distant. And, Dr. Fauci said something last week that even getting the vaccine, you still have to take those precautions. So we also need to be stressing that as well. And, but there is a number of strategies and it's just really, it's going to take a lot of work from everybody to make sure that we are on a path to where we can get folks vaccinated, particularly in communities of color.
Yep. Absolutely. And I will say to that point, and I think we need to continue those reminders, because I think for some individuals, whether because they've reached a point where they just, feel like they need to get back to normal life, or they just think that, things are somehow improved, even though, we're arguably in the worst situation so far of the pandemic. I think of a, constituent of mine, 86 years old, who just recently died of COVID in my district. And I saw him, a month ago downtown, and he was inside a restaurant with some of his other, fellow senior friends. None of them were wearing masks. And I just, shook my head that, especially a group of senior citizens, not to mention anyone, was inside an enclosed space. And it was really shocking and just, incredibly tragic and sad to learn recently that he died of COVID. So we really have to point out that these things, you should not be practicing these behaviors, if you will. But I will say, with respect to the racial equity lens, and you're here on your expertise on seniors and directing an agency, but and always say, when I'm interviewing, Black leaders, is obviously, you don't speak for the entire Black community, but as someone who's African American, are there particular challenges in terms of vaccine outreach, and what are your ideas about how to address these racial inequities that are already were already clear and have been made even more obvious as a result of the pandemic?
Yeah, absolutely. I mean, there is, Senator, there is certainly a number of challenges with getting the message across. And as you said, I don't speak for the entire African American or minority community, but from where I sit, as the director of this agency and being on a daily basis, in conversations and having a seat at the table is important.
Yes.
And so I would say having a seat at the table is important because it's being able to get information out there to folks and other leaders in the community so that we can then continue to educate our folks about the importance of the social distancing, wearing the mask, as well as getting vaccinated. So I think it really has to be a ground up approach.
Mm-hmm.
It's going to be a lot of work, but we have got to do it because if we don't, this thing will continue to spiral out of control.
Absolutely. Yeah. So we need to do that. And to your point about the seat at the table, I know there's a racial equity health task force that, has been meeting, and I think made recommendations to the governor as far as, legislation this year. And having that seat at the table is so critical. And I think also to have leaders in different communities of color, being the point person for communicating this message.
Yeah, absolutely. And
Really,
the other thing too, Senator, is that, while we are in the mix of trying to figure out this approach to making sure folks that are getting vaccinated, we're also dealing with an economic crisis, particularly among our older adults who have issues with food insecurity. Right here in central Massachusetts,
mm-hmm.
food insecurity. Folks are getting evicted from their homes and their apartments. And so we have all of these other issues compounding us also trying to educate our seniors and folks of color about getting the vaccination. So there's got to be a conversation as well. How do we address getting folks vaccinated, but also taking care of the food insecurity issue, as well as making sure that folks continue to have a roof over their head?
Absolutely. And that economic piece, I have been very outspoken, and, I know there's limitations at the state level. We don't, have the power of deficit spending, unlike the federal government, but, you know, there are there are ways, and part of it is discussion around taxation and progressive taxation, but there are ways to get money out on the streets, if you will, and directly benefit restaurant workers, business owners, people that are now at risk of facing eviction. And that's not just the federal government, obviously hopeful on the next round of the stimulus, but there are things that the state can do as well.
Absolutely.
And I'm just curious. I know you live in Worcester. You work with for Central America as well. And I think sometimes when people think about seniors, unfortunately, there's just a thought about white seniors is how do we make sure that seniors of color are getting the support as well that are more often than not facing bigger economic challenges. So are there efforts or strategies on those fronts you think that would be successful?
Yeah, absolutely. So, I did work for Centro Inc. in Worcester, which is a large Latino multicultural nonprofit in the city of Worcester. But, in recent weeks and months, there's been this coalition of folks that has been really focused on making sure that older adults of color in the Worcester, Central Mass area have the information that they need to be able to get vaccinated. And so there's a group, is the Black Families Together group, which is a group of African-American leaders across the city and really the county. And we also have the Southeast Asian Coalition, who we've been working with, as well as Centro Inc. Been working with the Latino community to get the word and the information out. So there is a contingent of folks that have been working with us to get the word out about the vaccine, as well as some of the other challenges that we're facing in terms of food insecurity, as well as evictions amongst our older adults here in Worcester and Central Mass.
Well, that's great to hear, because I will say, I advocated alongside Senator Harriet Chandler, obviously one of the senators for Worcester, for money in both the supplemental and the FY21 budget for money to go out to community foundations that would explicitly go out to vulnerable populations, often immigrants or people of color. And I think one of the frustrations I have is that okay, we passed that in the budget, and then the money goes to the foundation, but then what is the timeline for that money actually going from the foundation to actually the pockets of families or households? And that's where I do think about policies like universal basic income, or living wage, or even universal health care as a way to avoid so many residents across Massachusetts falling through the cracks.
Yeah, absolutely. And I would just follow up and say that we are in a deep hole in terms of the economic crisis in this country. And when you look at who we're all affected by it, but disproportionately it's our older adults and people of color. And I think the more support that the federal government and the state can provide right now will be able to help us dig out of that hole, so that way we can start living our lives again. And so it is certainly, the economic piece is a critical piece to overcoming COVID-19 as well.
Absolutely. And I just think about, I will say, I think there's a greater realization and appreciation from the public about, workers that, previously no one would call them essential workers, whether it's, people in nursing homes or healthcare facilities, or, even grocery stores, making sure, providing, food to the rest of us, is that, they are essential workers. I do think that the legislature, needs to do more. It sounds like there's some movement on emergency paid sick days for workers. So if someone, does get COVID, they can go home, quarantine, not put the rest of us at risk of spread, but also, not fall behind financially. And without those social safety nets, there is that pressure to continue to go out to work.
Yeah, absolutely. And it's, I cannot tell you, on a weekly basis, we get hundreds of calls from seniors who had not yet retired, but they were still working because they had to. But then all of a sudden they lost their job because of COVID. And now they're looking for the local food pantry or some place that they can get assistance to pay their rent or their electric bill in the wintertime, which is brutal here in Massachusetts. And so I think any support, as I said, that the federal government and the state can provide to help us overcome these challenges, I think is much needed. We really got to have a conversation about that.
Absolutely. And as someone that, was volunteering with my staff at some of the food pantries, is that, you see a growing number of, what I see is a particularly vulnerable population, those between, 50 and 60 years old that, they're not receiving Social Security. Unfortunately, a lot might not have savings. They might be working, but not maybe at the best paying jobs. They're increasing in the lines at the food pantries or falling behind on their rent. And I do think just to focus on that healthcare piece is that, my goodness, if we could just expand healthcare coverage to that population, imagine not only their healthcare needs being taken care of, but just the reduced financial burden when they're paying high copays and premiums on policies that, because of their age, are paying a lot of out of pocket just to maintain health insurance.
Yeah, absolutely. And then, one of the other challenges that folks don't often think about is, if you have a loved one that unfortunately passed away to COVID, then you've got to deal with the bill of a funeral cost and all of those things, which is putting more financial burden on families that may not have a burial plan or anything like that. So it adds more additional financial burden on families.
Absolutely. Absolutely. Yeah. So it just raises how all these things are interconnected. And regarding the Central Mass, the agency or the director of how many communities does it serve?
So we serve all 61 cities and towns in central Massachusetts.
Okay. So that's a lot. And that does cover some of the communities in my district, right?
Yes.
Yeah. That's great.
Kind of overlaps a little bit in some of the communities that you represent. But I want to talk a little bit about the uptick in senior scams since the start of the pandemic. So we are the official sponsor of the Senior Fraud Helpline here in Central Massachusetts in partnership with Family Services of Central Mass. And there has been an extraordinarily amount of scams, whether it be financial scams or just misinformation out there about the vaccine. So we really got to make sure that we're also protecting our older adults from these scams that could potentially take, thousands of dollars away from an older adult that are already struggling financially. So I'm wondering, Senator, has there been any conversations at the state level about how to tackle this issue of senior scams and fraud?
Yeah, that's a great question, Moses. And there have been, there's I know the Attorney General, does a lot of education about it. I think a lot of district attorneys do, and I think the state office of Executive Office of Elder Affairs. But it's not reaching everyone. To your point, I got a call from an Acton constituent this morning, and she got a call, actually a letter of someone claiming they were representing Medicare and saying that she needed to pay this to continue her health insurance coverage. And someone that I didn't think would be misled, but she really came close to her giving away some of her money. So this is where I just think the infrastructure, in other words, more state funding for our councils on aging,
Yes.
our boards of health, they are so overwhelmed now that they can't get out this message. And I think the other piece, and I've seen this with my district, is that the district I represent, a Metro West district, has really become a lot more diverse. There's a significant increase of African, Caribbean immigrants, Latino immigrants, and Asian American immigrants. And now, a good number of those individuals are seniors, but there's not the outreach based on language or particular culture. And so, that at the end of the day, we can't expect our towns or cities to do that on their own. There has to be, that funding from the state. And that's where this infrastructure is incredibly underfunded across Massachusetts.
Yeah, absolutely. And to your point, I think particularly with this issue of senior fraud and scams, it's important that we get more resources and information to our councils on aging and senior centers throughout, certainly central Massachusetts, but across the state on this very issue, because these folks are the ones that are on the ground daily, whether it be they're assisting with the grab and go meals, the Meals on Wheels programs across the state. I think as much support as we can provide them, I think is critically important.
Absolutely. So I'm really glad you raised that. I think we're going to put something out on our e-newsletter and website. But I just, every time we're able to get together, I learn so much and really appreciate you coming on and sharing your perspective and your leadership. Thank you for what you're doing. And I really appreciate you coming on to Uplifting Voices. It's great to see you, and thank you for your wisdom, guidance, and advice.
All right. Well, Senator, thank you for having me on. I'm happy to come back on at any time.
Excellent. Well, thanks everyone for tuning in. Again, Dr. Moses Dixon, CEO of the Central Mass Agency on Aging. Honored to see you again, and we'll be in touch. Have a good night.
Take care. Be safe.